I think that they should look, because it's about the health of the people. It is about the health of our mothers. It's about the health of our kids. And it's the health of the people of Ghana. Right. So I support that policy fully. And going forward, I know that with the 150, government will increase it so that it will cover all the districts in Ghana.
Yeah. Thank you so much. Sefah.
Yeah, okay. So the whole primary healthcare thing, it's not brand new, because when the NPP inherited government from the NDC in 2017, NHIA, for instance, had arrears going back about 2 years in terms of payments to the providers. By the time NPP left office, not only had we caught up to the best practice of 3 months in arrears, we even left about 1 billion cedis in terms of surplus at the NHIA. That's what was left. Around that time, too, we had already started. Remember, we had a free care for those that had kidney disease and other things. We had started that. And then we also had just introduced the free checkups for all citizens. And that was also being rolled out because we had the capacity. Where did they get the capacity from? Most of these things had been inherited from us. I'll give NDC credit. They are amazing with branding. I was even looking at the president himself talking about how just yesterday in a speech in his wine-colored, nicely tailored John shirt that he had on, looking with his shades. He looked good. He was very attractive. No wonder the ladies tended to really vote for him. And they are great with branding. So they are good. I'm making a point.
Okay.
They've branded.
Dr. Kamal, please.
Sorry. So when we said that we had programs for all these terminal and serious diseases like kidney diseases and all that, and we started the free checkups and all that, they've come in and they've branded them very well. I was talking about branding. Now they call those diseases that we were giving free access to, they call it Mahama Cares. They've even created some agency out of it. And then they call the checkups and all that we had implemented, they are calling it the primaries, the free primary
health care.
So they've branded them well. But these are all NPP stuff. How could they have implemented it when they handed over and the NHIA had 2 years of arrears? Where were they going to get the money from? So you see, if you look at the NPP's record in the health system, I mean, it's amazing. Completed 6 out of 9 stalled and abandoned Eurojet health sector projects from President Kufuor's time. That's what Nana-Addo did. He started and completed 47 non-Agenda 111 hospitals, clinics, and healthcare projects, including, please, can I finish? 47, including 21 clinics through IPEP. He started 17 non-Agenda 111 hospital claims healthcare projects, currently at various stages of completion, including 5 clinics through IPEP. Started 21 new treatment and holding centers, 13 of which have been completed, and started the Agenda 111 hospitals, 307 ambulances. I mean, the record is impressive. I have the document here. I can share with your producers. You see, so we created all these amazing projects and development efforts that have been put in place. When you talk about Agenda 111, for instance, do you know how much money they put in the budget? Something that they told the people they were going to continue. When they saw that the thing was too popular, they said that they will come in. Initially, they were criticizing it. Then they said they will continue. 100 million cedis is all they put in the budget this year for it. Instead of really ramping up the effort to complete these hospitals, when you are told the nurses that you are going to hire them automatic posting, okay? That's what they told them. And instead you come in, and instead of completing these hospitals, like one at Kokobeng, which is literally done, I just saw a video about it. Instead of completing them, and making sure that you hire these nurses that you promised, and then now you're reneging on those promises like almost every other promise. All right? You're sitting here and branding things and then calling them as if they are your new ideas.
Okay.
Where would you have even got the money if we didn't leave those reserves for you to come in and brand and then say that they are your new ideas? We're happy that we're making progress. And we need more of these progress in terms of road projects that are so close to completion. Those things must be completed.
All right.
Same thing for at least the Agenda 111. Some of them are practically completed. Operationalize them. Hire people.
All right.
You're not doing those things. And yet you come in here and you want to now take all this credit as if you've come up with new stuff. There's nothing new here. We left these things for you.
Yeah. So this okay, Pastor. Let me hear from you. Let me hear from you.
So I'm at a loss as to whether anything was left, because he left the primary care, and to the best of my knowledge, it's now that the ministry intends to roll out an effective and efficient primary health care. So let's put that in perspective. And the reason why, if you take